right. Good morning, Carol Johnson.
Good morning, Bob Ponce.
You
How's
got
it going?
alarms going off and everything, huh?
Everything I tell you. A woman's work is never done.
Never done, never done. And so what we're going to talk about today, same old thing.
Same old, same old.
So
Same stuff, different day.
yeah, pretty much, pretty much. So our lead story, we're going to talk about continued vaccine inequity in terms of who actually gets the vaccine. And, we've been talking about it, but it's covered by a lot of other publications as well. Both Gothamist and Patch this week talking about how the new COVID vaccine data shows which parts of New York City are being left behind. And surprise, surprise, the Manhattan neighborhoods with the income levels between 100,000 and 150,000 average, they've got the highest rates of vaccination, even though they've had the lowest rate of COVID.
hmm
Surprise, surprise.
Right. Yeah, I am. You should be.
I'm, I'm shocked.
Come on. After
Mhm.
all, shouldn't that be the first area that would get the help?
Seems so, and yet our mayor feels like this is not a failure of his administration. Um, and I don't know. I think the evidence suggests something different.
Well, if it's not his, then whose is it?
Hmm.
Because we're sure fighting for sites,
Right.
major sites, for mass sites, like,
Mhm.
the other boroughs have. We're still fighting.
Right.
We're still waiting for La Maqueta. That was one of the first three named to open
Hmm.
the mass vac site. What's that, like a
Hmm.
month now? We're still
Hmm.
fighting for that to open.
Hmm.
Johnson Center has put their name in the ring. I put their name in the ring a while
Hmm.
ago when they first started talking about the vaccination centers.
Hmm.
That center is sure big enough to hold close to 500 folk.
Hmm.
So there's enough space there. There's other rooms where people could sit back to be monitored.
Hmm.
Um, they have a stage area. It's an indoor outdoor stage area. So this is in the gymnasium, but there
Hmm.
is an indoor outdoor stage area where when the show is outdoor, they close one side, and when they want to bring the stage in, they close the other side. You can
Hmm.
close that off completely. That's another area where people can wait, you know, to
Hmm.
be monitored. So we haven't heard anything. We're still waiting to see what's going on with La Maqueta. We are
Hmm.
still waiting, and the waiting game continues.
Hmm.
So, we offered different spaces because we were asked, such a mishmash because it was like we've been offering locations. Then the governor made a statement that he's not taking any location suggestions from any community board organizations. Then he came back and said, if you want to work with a city agency, we will consider your recommendations. Then the city agency sent us a form to fill out with those locations. So, which is it? You don't want our help, you only want partial help. Now you're asking us succinctly for help. And meanwhile, weeks are passing, more people are getting sick, people are still dying, and those death numbers are so erroneous, you know. And in particular in Harlem, there's thousands of people that have died from coronavirus, and those numbers is just not accurate.
Hmm. I mean, the bottom line is very simple. You get the locations open in the neighborhoods that need it most. It's a simple formula. Either you do or you don't. If you do, it's a success because you allocated resources to the area that needs it most. If you don't, it's a failure.
Right. and those other areas will survive. And ironically, when we first started this, um, so we've been in those meetings with the city agencies from day one. And first thing I said was, you have to start from the bottom up, but you guys always start from the top down.
Mm-hmm.
That's been my rallying cry
Mm-hmm.
all of this time. You have to start from the bottom up. And it's like falling on deaf ears.
Mm-hmm. Now, this week also, people with underlying illnesses under the age of 65 are now eligible for vaccines. As a result, of course, appointments jumped, and people are having a hard time getting appointments. So that's no surprise. Once again, just doesn't seem to be a plan on dealing with the additional demand. And when you see this additional demand, it also seems like the whole narrative of vaccine hesitancy is the reason why the vaccines don't get out in these neighborhoods. It doesn't real to me. It just doesn't hold water, because even if the vaccine hesitants have not stepped forward to get the vaccine, there are so many people who want it. It's been done in stages. We know that the over 65 group of people have been doing their best to try to get it, and yet it seems only the over 65. We talked about vaccine poaching last week, and that was the issue of people coming from outside the neighborhoods who need it to be able to get vaccines. And we talked about the lack of transparent information, so that somehow it happened again where people from Westchester, New Jersey were able to find out about vaccine availability in Harlem and in the Bronx, when the people right down the street couldn't find this information. It wasn't on the vaccine finder. So these issues, we still have to keep talking about them, and what are the actual solutions that are being shown to us. Yeah, go ahead.
Yeah, no, the hesitancy again is from their side. When this
Hmm.
thing first started, you know, we've been pushing, 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 pushing. You have to create the narrative. You want us to run around and create it. You have to create it because we're not doctors.
Hmm.
We're not healthcare professionals. So the hesitancy that existed was because of lack of information that, you know, is always, it always has a problem with us. Information getting to us. There always seems to be something that derails it. It gets to everybody else. And the ironic part is when you look at a lot of these different areas who have been vaccinated, those were areas that was hot spots. But you had people of influence who weren't paying attention. They were running into these bars and hanging out and doing all of this stuff to get those numbers up so high. And now those are like the first people that's getting the vaccines. So
Hmm.
there's something strange about that. But the hesitancy was on their part for not getting out there when they first started speaking about vaccines. They should have been pushing it harder than anybody who was saying nay to the vaccines.
Hmm.
They should have been giving people information that these vaccines have been around. They're not new. What was people saying? Oh, they rushed and they found a vaccine. They already had like the main ingredients. You should have been pushing that information. But no, it just lagged and it lagged and it lagged. And a lot of those people later on said, well, I don't want it because I don't know what's going on. But then when the vaccine came out, people were jumping for it. But there's no appointment. There's no vaccine available. However, it's interesting that 62% went to people of influence and not people of color. So if that's not their problem and their fault, then whose fault is it? It's not my fault. I pretty much can say it's not your fault. So
Mm-hmm.
whose fault is it?
No one wants to take accountability.
And that's what it is. I mean, and the thing is, you're going to keep hearing the same thing over and over and over again. It happened in the beginning. It's still happening. We're still having problems with testing sites. It was happening in the beginning. All these sites was open downtown. Even when the medical centers finally opened up, the only one that was open, the closest one to me was 53rd Street. 53rd Street down to Wall Street.
Mm-hmm.
But there was nothing here. Finally, we had one place, then two places open. But PPE distribution, same thing. Every time you turn around, our location was different. It was here, it was there, it was there, it was there, it was there. The people showed up 2 hours late. They gave away the majority of the mask at one location where we were someplace else. And then they claim, well, they didn't give us an address. They just told us to go there to the area. And they just started giving out masks in another place. The same thing. But downtown, all their locations was the same place. Very easy to remember. Oh yeah, let's just walk to 51st Street and Lexington Avenue and pick up some masks. Not us. It was all over Harlem. It was like a game of musical locations. And now we're in the same part, the same exact things happening now. Again, if nothing changes, nothing changes. We are still scrambling for locations, and again, being, I can't help but think like the 50s, we had to be bussed out. Now you want us to taxi out. And they say the taxi program is a mess. A group of medical students, tried it out. It is a mess. But here's the funny thing. Yesterday, I called for two different cabs, accessible cabs. Now, for about 5 years now, New York has had accessible cabs. And my experience has always been, once you call 311 for that cab, you'll get a text message saying that, you requested a cab, and you'll get another text. The next text is going to come from the cab company, that the car that actually picks up your ride. So I'm sitting there, I'm waiting, I'm waiting, I'm waiting. I said, a text message should have already come. No text message ever came. Never. So these cabs and these and Accessoride is being used to transport people back and forth to get vaccines. Because I said, it's not by coincidence that this is the first time in 5 years that has happened.
Mm-hmm.
And they don't have a whole truckload of accessible vehicles as it is.
Hmm.
I said, first thing came to my mind, transportation for vaccines. And now the rest of us can't move around the way we want to because those vehicles are not available.
Wow. So another story is that food workers are now eligible for the vaccine, but getting it is another story. So restaurant, delivery, and taxi workers can only be vaccinated at city-run sites or mass vaccination centers run by the state. And in particular, they set up City Field in Queens so that 50% of the 200 daily appointments set aside for food service workers and taxi drivers, um, so City Field, half of the appointments there are for food workers, and they have to go through either the Yemeni American Merchants Association or the Taxi and Limousine Commission to get those appointments. And the city.nyc is reporting that, like all of these processes, it's not happening too smoothly because there are language barriers and the information is not getting out. So the average bodega worker doesn't even know that they can go and get a vaccine at Citi Field because there's really no real mechanism to get the information out there. So once again, we see things that are halfway implemented. Uh,
It's
and
very interesting. I had to make a call to a government agency, and I sat on the phone for 27 minutes. I timed it while I listened to the same message. It was repeated in English. And then it was repeated in another language. And then it was repeated in English. And I said, well, if it's in another language, why do they have to keep repeating it in English? So this like at 27 minutes, while 9 different languages was repeated, you could not get through to this agency unless you sat through that entire message. You know, and
mhm,
so if you can do that there, I'm not understanding why you can't seem to figure this out. That
mhm,
there are a lot of people who have language barriers. And for you not to be able to get something in Spanish, that is reprehensible.
mhm,
I mean, really. I've got Spanish and Chinese translations in my hallway. And now we have East Indian. And I'm like, why is it? And you know already that the majority of those workers are people of color.
mhm,
A lot of them don't speak English.
mhm,
You know, they're Spanish, they're Chinese, they're Japanese, they're African. This is not by happenstance. It's just it's just incredibly sloppy. It's almost like you created a bad meal and you knew it was going to be a bad meal, but you created it anyway, and then you want to force everybody to eat it.
mhm. And we are also keeping our eye on the all of the variants of the COVID vaccine or the COVID virus that we're looking at. And the CDC is saying that the UK variant is probably going to be the dominant strain of COVID-19 in the US by the end of March because it's spreading that much more quickly than the others. But
Yeah.
there's 7 different strains that they're looking at. There's the UK strain, there's the South African strain, there's the Brazilian strain. And so we are keeping an eye on the data and really demanding more data because we all have to stay apprised of whether these variants are still whether the vaccines are still going to be effective with these mutations. And so we're still sketchy about the information, the data, and that's always problematic because as we've seen, when the data goes south, the data goes missing. This seems to be a common pattern that we've seen that every time, the data is showing something negative, the data goes missing. And we didn't talk about it. I think there were some stories last week about the nursing home data and some allegations that there were some cover ups on that. So let's see if I can find more information on
Yeah.
that.
And that one on 79th Street. Um, there were times when I said I was glad my mother was no longer here amongst the living because I saw so many crazy things. And that was one of the nursing homes that she went to every time she needed rehab. And with MS, um, relapsing the form of MS she had, she always had to go there for rehab. That one on 70 East 79th Street, and I'm saying I'm I'm just glad she wasn't here, because if she was still going through that type of rehab, she would have been there. The first time was in during 9/11, and you couldn't explain keeping somebody safe, even though it happened downtown and it was the attack there and it wasn't going to attack anywhere else in the city. It's kind of difficult to explain that to somebody and make them feel safe, and you're quadriplegic and you can do absolutely nothing for yourself. But yeah, that place had a lot of challenges and problems when we were there, but the care was good. It's just a lot of other stuff was delinquent, you know. But yeah, those numbers are really, really off. But Letitia James is going after them, and I don't think she's going to stop until she gets them. Even though they're saying the data that they have is the data that they got, but they're already proven that's not true, because we already have different numbers. So you can't say the data, that's the data. You can't say that. How can you run with the same stuff? So this is what I was saying earlier about deaths that were never recorded, and it's just so much stuff, and there'll be so many more. And even now with the variants, your behinds need to be out there telling people about this, because you still got people thinking, oh, once we get that second vaccine, we are absolutely fine. Forget the variants. Let's forget the variants for a second. Once we get the second vaccine and we go through that 2 week or a month grace period, then we'll be 94% safe. Those people need to know that they can still get COVID. They're not pushing that either. I was on a thread with one of my groups, and the guys, I couldn't believe it when the guy said, well, I'm not worrying about it because I got the antibodies. What part of this did you miss about the antibodies? If you had antibodies, you wouldn't need a vaccination. If your antibodies were any good. It's this kind of information, but you know what? That information gets to where it's meant to go. And I'm always reminded of how, even growing up as a young woman, and my doctors were never in my neighborhood. I always went outside because I wanted to live. So I'm not saying the hospitals were bad, but I knew I was going to get better care. My mother always told me, you get your education from them and you follow them, and you'll have the best of whatever you're looking for. And so I'm going to the best hospitals. And I noticed when I would go into, GYN, there were all these bright, happy pictures of the women with babies, but they made sure that the hand that they was holding the baby with had the wedding ring. Wasn't an engagement ring, it was a wedding band. And you had well babies and happy parent magazines. And then when you came to Metropolitan, there were pictures of 15-year-olds with a big sign, how to get food stamps, 15-year-olds with babies suckling, and nothing positive. Nothing positive. So the same way that information always came back to us, like, this is natural. Show your 15, 16-year-old daughters that this is natural for you to have a baby, because guess what? You can get food stamps and welfare to take care of you and your baby. Nothing nutritional, nothing positive. And so the same way that information is always fed into our communities, just the complete opposite is fed into the other communities. And that's why they got 62% of the vaccines. Because they get the information. They get it when they're not even looking for it. So it's like, as the world turns, to be continued.
Yep. So I think we're going to wrap up our show here today. We're going to continue to keep our eye on these stories. Um, look like I'm frozen. Uh,
Yeah, you are. Come back, Bob. Come back.
okay. That's interesting.
So, the meanwhile, we, as always, we ask people to pass this information. Ask. Ask questions. Don't just sit back and say, I can't get a vaccine. You got to ask questions just like we do. And the more
Right.
people you have pushing back, the more they're going to have to respond to these questions. So, you got to ask. You got to talk to your providers, your medical providers, even if you don't have a PCP, a personal care physician. You can always go to a hospital and speak to a patient rep, a hospital representative. If you're unsure about the things, you can go into a medical clinic and just say, I just want information on things. Community medical centers are usually more than happy to help you. I suggest that you call first, though, because of the virus, everybody has to be screened. But, get that information and pass it on, and make sure that when you get that information, it's it's the real thing. So we're having technical difficulties, and
Okay.
so do your best to get that information, pass it on. Don't pass on rumors. Don't pass what you think. Thinking is for those that's not sure. um you know get some viable information and pass it on to your neighbors, your relatives, your friends, and let them know. We post the names of the publications that we use, so that you can go back to those publications and find it. We're not making this stuff up. um and just stay safe. Just stay safe and do your best to get that information and stay informed. And so it looks like we're going to be signing off. And everyone, have a great day. Happy belated Valentine's Day. And stay safe, stay alert, and stay aware. And we wish you good health, and talk to you guys next week. Same place, same time.
Okay, we're back and we're ending the broadcast. We had a few technical. Wait. Here's Carol. Hold on. All right, we're back.
Oh, I didn't know you were coming back. I signed off.
Okay.
I said, you took a vacation without telling me. Didn't even invite me along. Wow.
Hey, hey. I must spread a fake conspiracy theory. They're trying to shut us down.
You can't handle the truth.
That's right. Well, that's all we have for today. We will keep our eyes on the developing stories. We'll continue to look at vaccine inequities in terms of distribution and vaccine poaching. We're going to continue to look at the issues of transparency and information, and try to give you the best available information so that you and your family can make informed decisions about what you do during this pandemic. So
Yeah. Yeah. And again, we're not personally attacking any of the agencies because we have wonderful colleagues in, all of the responding agencies, from the mayor's office, the governor's office, Department of Health and Mental Hygiene, New York City Emergency Management, all those recovery teams. We have wonderful colleagues, that have always been helpful. And we pass on our thoughts to them. But if it's not going to be listened to, that's the problem. People see what we see. It's not like they don't see it too. So they do ask us, and they do their best to push that information to the top. you know but if the top is not listening, there's your problem. The top is not listening. But at no point do we ever think that they are not getting our concerns in and constantly pushing for us, constantly pushing for the hardest hit, and the most vulnerable areas. But it's at the top. You've got to start listening.
right. I mean, the bottom line is we have to do better. You know, it's not enough to say, "Oops, we didn't get it done," especially when we've been talking about these problems since the very, very beginning. The problems that we keep discussing week after week, they're not new problems, they're the same problems. And that's the part that we find very, very difficult to deal with, because it wasn't like it hasn't been brought up. It wasn't like these things were not on long range radar. Everything we're talking about in terms of vaccine distribution, this stuff should have been worked out in September and October. Everybody knew this was coming. And so to get here, where we're now in February, staring into March, where we're coming up on a year that we've been dealing with this pandemic, and for us not to have the systems in place. It's one thing when we talk about last year, March 15th, going through March 30th, when everybody just got blindsided. We got hit. There were not plans in place. But, since then, we've seen so many different institutions that have had to come up with elaborate plans to be able to deal with the pandemic. And there's just no excuse for us to not be delivering services to the areas that are hardest hit at a higher level, at a much higher level than we've been doing it. And so we'll continue
Again,
to
it's
here. Go
I'm
ahead.
sorry, but again, it's across the board. So if
Hmm.
you saw it wasn't working with food deliveries, and the hardest hit was not getting food, and you saw it wasn't happening with PPE distribution, and you saw it wasn't happening with testing sites, and now you see it's not happening with vaccines, the beginning was a telltale sign that things
Hmm.
needed to be reversed. And again, starting from the bottom up.
Hmm.
you know Even the types of food,
Hmm.
unhealthy, unnutritious food that was coming into our areas. Sedentary people with high blood pressure and cholesterol issues and diabetes did not need to eat that kind of food. I know stuff that was being delivered to me. I knocked on my neighbor's door. You want this? Because I can't eat this. And I
Mm-hmm.
don't even have those problems, but I can't eat this stuff,
Mm-hmm.
you know. So I didn't want to throw it away, just throw it away because if somebody else wanted it, but you saw it wasn't working there. And everybody was complaining. And then you saw the next phase and it wasn't working there. And yet you're using the same model to now work with the vaccines.
Mm-hmm.
Because I know downtown was getting roast beef and rice and veg, steamed veggies and dessert. And we were
Mm-hmm.
getting cheese, macaroni, pasta, all kind of cheese and macaroni pasta dishes. And who eats that for breakfast? Because that's what
Mm-hmm.
they told me to eat. Chicken fingers and macaroni and cheese and broccoli for breakfast. I mean,
Mm-hmm.
come on. But people were getting good, nutritious meals in other areas. And so you saw it wasn't working.
Mm-hmm.
And then you saw every phase of this, the same demographic was being affected.
Mm-hmm.
So where are the surprises? So you use the same exact model and you move to the next phase with the same exact model. And you say, it's not me. It must have been them because I didn't do this. I don't know how this happened like this. I don't know why you planned it that way. So, I mean, come on. At what point do
Yep.
you change your direction?
Mm-hmm.
Or guess what? Accept full responsibility. There you go. Accept full responsibility. That might call a lot of people back. Well, at least they're saying that they're accepting it. And then you still got to change.
So, thanks for joining us. Please continue to share this information with your friends and family. And we're here every Wednesday morning at 9:30 with the latest on what's going on with this pandemic.
So stay safe. Continue to social distance, whether you've had both vaccinations or not. Continue to wash your hands frequently. If you don't live alone and people are traveling in and out of your apartment, continue to sanitize frequently, touch surfaces. Remember to spray them, let it set a few minutes, and then come back and wipe them down. Um, remember to wear those masks. Make sure they don't have gaps. Now they're suggesting that we double mask. So that may be a problem for people with respiratory problems, but we use things like coffee filters that we could put in there. The 3-ply surgical mask is better than a lot of these cloth masks that don't really stop that aerosol from coming through. So you want to get even the what looks like cheap surgical masks. They're not. Some of them are 3, some of them are 5-ply. And use what you can for breathability. As long as you can breathe in it and be comfortable in it, but you need something a little stronger than what I see a lot of people out there with these little scarves and stuff. That's not going to work. But you still got to socially distance and eat healthy as you can.
All right. See you next week.